works or not. Is the same going to be true for Moderna's, do you think?
That's difficult to answer because it really depends on how many people come down with symptomatic COVID after they've received the second dose of the vaccine. And that's really the primary endpoint, is looking at the number of people, or looking at the patients who come down with symptomatic coronavirus, and then looking at which of those patients had the placebo and which of those had the vaccine, and seeing if there's a significant enough difference to know that the vaccine works. So it depends on how soon people in the study become infected with coronavirus.
Yeah. Mark, you felt a calling to do this, a public duty of sorts, as you described it in the Washington Post. You have friends who have suffered from COVID. Where are you in this process, and how are you feeling?
Well, thanks, Poppy. 2020 will be remembered as the year of civic engagement. Some Americans will help the victims of wildfires in 10 states. Others will choose to support people being impacted by the hurricanes in the Gulf state. I'm one of 30,000 volunteers that want to end the pandemic.
So how do you feel? I mean, have you gotten both shots, one shot?
I received both shots. It's a double-blind study, so the participants don't know and the medical practitioners don't know what who got the shot or who got the placebo.
You feel all right, though? You look healthy.
Thank you. I'm happy to be able to stand on the shoulders of giants like former Congressman Louis B. Stokes from Ohio, who spent 30 years in Washington trying to improve health care and advocating for minority health. And the former dean of the College of Medicine at the University of Maryland, Donald Wilson, who spent his entire career recruiting and training students to work as primary care practitioners.
Dr. Siegel, participation from folks like Mark is so important, and you guys were the first, Moderna's vaccine, to slow down and say we can't rush this, because if we don't have enough minority participation and representation of Blacks, Latinos, etc., we're not going to know if this works for all of the populations, especially those that have been disproportionately adversely affected by it. Can you speak to where you are now in terms of that representation?
So we are, as a site here in GW, we were aiming to be at least enrolling 30% people of color, and we are above that. We are over 50% enrolling people of color, and so we are encouraged by that. We are encouraged by the willingness of people of color to participate in the study. Study-wide, there's been significant improvement since the beginning of the study, and we are seeing significantly better representations of people of color, so that by the end of the study should more accurately represent the demographics of the country, and therefore give people confidence that it works for everybody and not just one specific subset of the population.
Well, Mark, what do you say to your fellow Black Americans who do not trust this process and who do not, given the history in this country, Tuskegee, et cetera, have concerns? What is your message to them? Because one of my favorite quotes of yours, Mark, that I read is, "I trust science."
And I do, Poppy, and I would say that, during the 40-year Tuskegee syphilis experiment, it took one brave person, Peter Buxton, Buxtun, who was a social worker, 5 years to expose the experiment. Today, it would take an hour on social media and, of course, with the help of mainstream media. So people should understand that our country is in a better position to safeguard their healthcare delivery now than any time in history. You have people who are researchers from Santa Barbara, California to Washington, D.C. that would never waste 5 years trying to expose a biomedical disaster like the Tuskegee syphilis experiment. People like Dr. Stephen B. Thomas, who's in the public health school at the University of Maryland, His scholarly contribution led to the apology by the president to the victims of the Tuskegee experiment.
It came decades later, but it was critical. Before we go, Dr. Siegel, to you, Pfizer CEO, I'm sure you watched the interview over the weekend, but he explained why Pfizer is not taking government money for their vaccine work. They're spending $1.5 billion of their own. Moderna, though, is part of the government collaboration here and is taking money. He said, quote, "I want to keep Pfizer out of politics." Should people be concerned that the government is working with you guys, for example, or do you believe that is advantageous? I just wonder what your reaction is to those remarks from him.
I think it's advantageous. I mean, the government is funding the production of the vaccine simultaneously with us running the trial, so that if the trial is shown to be effective, we won't have to wait months to years for enough vaccines to become available. And that is really because of the government funding of this study. So I think it's advantageous. I know there's concern about political interference, but as you know, the researchers have committed to making sure that this study is run scientifically and that the results will be released when we know that they actually are safe and the vaccine works. So I think it's actually a win-win situation. We have science going on as it usually as it's expected to do, but we also have the funding to allow us to roll out an effective vaccine if it's shown to be effective quicker than we would otherwise be able to do.
Dr. Siegel, thank you. Mark Spradley, thank you both.